All right. Hello, hello, hello. It's Tamika of Love Inspired Teach E, our Light Fires podcast host. But I've been sharing this breast cancer journey that I'm on. So if you know, you know that I have stage 1 breast cancer. I have what's called breast cancer is way more complicated than just the pink ribbon campaigns that we're probably also familiar with. So there's more details into the type of breast cancer I have, as far as I have what's called ER positive, PR positive breast cancer, and I have HER2 negative. So ER positive and PR positive relate to hormones. So that means that ER positive and PR positive means that my estrogen progesterone feed my cancer. So I've always known they were going to force my menopause, which I was already perimenopausal, but they were like, yeah, you're definitely going to get those hot flashes, but we don't want to feed the cancer. So that's fine. And then HER2 negative is actually supposedly a good thing because that type of cancer can be really aggressive. So I'm negative and I don't have that. So out of the types of cancers I have, I was told I have the best kind of cancer there can be. And my first surgery is when they cut the tumor out and sent off the pathology. So I still don't know what the pathology is going to be. And I have an appointment today. So that's part of why I was like, oh, let me look one last time. So it's been a little over, well, a little under 2 weeks post surgery. So if you've seen my photos and pictures, you've seen like the first surgery, it wasn't that bad. There was swelling, but my swelling made everything look good. The second surgery, whew, that swelling was terrible. And one of my girlfriends who I talked to when I sent her a picture privately before I decided, like, let me bite the bullet and go ahead and share because I said I was going to share, she was like, it reminds me of breastfeeding and it being swollen from that. And it hurt just like that did. So that's what type of swelling I had and I still have. So that's what I'm actually going to check on. My doctor's going to take a look. She's going to give me some updates. But that's what I was going to show y'all too is like, I didn't have bruising the first day, but I'm still bruised from the surgery. So this side is normal and I've been wearing these. These are better post surgery. I have to wear sports bras, and the sports bras are soft support. They don't have the underwire, so they don't dig in. I have to wear them like 24/7. Is basically what I have to do. So post surgery, if you watch before, like you can actually see. I'm a the easiest way is going to be to show you through here, but I have bruising all around here. And what they're going to do is they're going to take off the bandages that are here, um and take a look at the incision site to make sure I don't have any, infection or anything like that. But the swelling's gone down, so believe it or not, like I'm still super swollen, but this side is still really really bad. So just post surgery wise, like I'm not gonna show, but like I am, this part is really super bad. But to show you the bruising and how it's changed, like you can see I have like the bruising still up here, here. It's all along there. So it's been really rough, really bad. And it was hurting. But now I will say like it doesn't hurt the way it used to. Um like I stopped taking the first night I had to take what they give you, something that's like a narcotic level of pain relief, pain medication. So my pain management the first night of the second surgery was awful. Now I don't actually take Tylenol that often. I can handle it pretty well. But this bruising, like there are times throughout the day where I'll feel like tingly sensations. I'll feel like I'll move a certain way and it'll tug a little bit. I actually tried to exercise for the first time yesterday, but everything's looking pretty good. Like this swelling, I tried to massage it a little bit, but this swelling is nothing compared to like before. It felt huge, it felt in the way, it was uncomfortable. But my surgeon, so I posted on Facebook a couple days ago that my surgeon actually said that she had good news about my pathology. So I guess let me back up and just explain my surgery. So I told you what type of cancer. I have breast cancer stage 1. Um, the plan was to do a lumpectomy. The lumpectomy was my choice. I had a choice between the lumpectomy or a mastectomy. And given that I had stage 1, I really didn't feel a strong need for a mastectomy, which is where they take the whole breast. And there's cool technologies now where they can do nipple sparing. Um, but my cancer is located like here in this area, and the tumor, because I did have a tumor. I have DCIS, which is ductal carcinoma in situ, meaning it was in my breast milk ducts. And the tumor is called invasive cancer, and the DCIS means it was still just within a contained area. So they cut that out, but the positioning of your tumor and the positioning of your cancer is actually more so what determines if mastectomy was going to be required. So I was fortunate to have the option to choose a lumpectomy versus them just saying the best approach is to take your whole breast and we'll do reconstruction or whatever later, which they still have to do with the lumpectomy. But the lumpectomy we did the first time, they check for your cancer cell margin. So once they cut it out, they try to cut a little bit extra, and my margins were like barely within guidelines. So then my physician has a whole team that she consults, and everyone's like, we don't all feel one way or the other. This is when you do patient involved care. So then she shared with me all the data and was like, you get to choose. It's just like, if y'all couldn't choose, why do I have to choose? But I get to choose because it's my body, it's my my survival rate that we're trying to fix. And the whole point of surgery is to prevent recurrence. So the other key thing to know is that whether you choose a lumpectomy or a mastectomy, is that um, the recurrence rate is about the same whether you choose lumpectomy or mastectomy. So my margins, though, if we followed the rules, I could have just went to radiation, but we were a little nervous that what if there's way more cancer than we thought? Like, is that really going to be the best approach? And my doctor said she could go back in and double check my or get better margins for me, or I could just say screw it, let's just proceed to mastectomy. So I went with option number 2, and thankfully, option number 2, the good news, and this is where I had to back up. My doctor got the pathology back, and this time when she cut in, my she was able to get clear margins. So that was the good news. Now, with that being said, you kind of also have this thought like, man, we should have stuck to the rules. Like, did we really have to cut in? Should we have done this? And she also shared another story with me where she had another patient who was in a similar situation, and that patient, she was so excited about my pathology because she had another case where when she cut back in, there was more cancer. So us all having my surgical team and my cancer team, because it's more than a surgery team, and I having that peace of mind and knowing my margins are clear, this was the right thing to do just to be certain, and without me being stage 1 and going what I felt was drastic. Like, I just didn't want them to take my whole breast, because I was just like, how do I have stage 1 and you have to take this what felt like an extreme approach to my treatment, to my recovery, all that. So today, when we go in, I'm hoping they'll have the tumor results back, because with the tumor results, you find out they already knew some things about what type of breast cancer I have, but now they should know specifically what type. And then when I go to see the radiologist, then I'm going to be able to find out what my radiology schedule will be, how they can target my radiology, and that's what I really really want to know. And also, the other hard thing about this decision was if I had gone and got the mastectomy, you don't have to do radiology. So they take your whole breast, but then you don't have to do radiology. Whereas if you let them cut pieces out of you, then they want you to do radiology, because that's how they've made it so that your recurrence rate matches that of a mastectomy. And the whole purpose of all the radiology is so that any cancer cells that are floating around, that they couldn't take out with surgery because they can't see. They don't necessarily know which ones have it, even though my surgeon did say she can see a difference in the tissue, but they still can't see that across the whole breast, right? So the radiology will go back for any of those cells that were missed and take the cancer out of there. Whereas if you do a lumpectomy, obviously, if you do a mastectomy, obviously they've taken the whole breast. So now you don't have to do the radiation because there's less likelihood of the cells being floating around. But that's what I'm walking into. The doctor's actually going to take those little steri strips that I showed off, and she's going to look at the incision site. And the nice thing is the second surgery, when they did it, so they cut in around the edge of my areola so that it wouldn't be obvious that I had surgery. And when they did the second surgery, they were able to go back and do the same thing. Now, had I needed to have a bad pathology results, they would have had to cut the whole breast, but I asked them, I was like, can I still get the nipple sparing surgery? Otherwise, it's a whole thing where they have to recreate a nipple that's always going to be perky, and then they tattoo your areola on. So if you ever wanted to know how do they do that for breast cancer reconstruction, that's how they do it. And that's even if you get an implant, because that was going to be the next choice to make, like, how do we do reconstruction? So moving on to, yes, I have radiation next, but there's also a reconstruction question she's going to ask me next. And for my reconstruction, so this swelling is going to go down, and there's going to be divots or dimpling in my breast from where they cut out tissue. And then you meet with a breast cancer, a surgical specialist. Well, I did. And my surgeon's been with the University of Chicago team for a really long time. So she felt confident she probably wasn't going to need a lot of help. But because she cut deeper in and had to go back further, um, just keeping the appearance the same wasn't going to be as guaranteed. So she consulted with the reconstruction surgeon, and the reconstruction surgeon kind of guided her on how to rearrange my tissue. And that's why she thinks I had even more swelling than normal, because we're trying to achieve, I know I'm going to lose size, I'm going to lose volume, but the shape is what she was rearranging the tissue for. And so you get to make this other decision, right? So here's my decision was at first, like, what kind of surgery do I want? And now treatment wise, before they do radiation, if I'm not happy with these results, she told me, shape wise, I'm good, but volume wise, we don't know, because the swelling, there's just a lot you don't really know. And that's where reconstruction comes in. So I don't want an implant. They didn't want an implant, but she's saying I can look at other options of how we could ensure that there's volume, because it may seem a little mundane or superficial or all about aesthetics, but radiation, the other joy of radiation, not only does it kill the cancer cells, but it's going to shrink the breast. It has the high potential. No one will ever say, we know 100% this is what it's going to do. But it's going to shrink the breast and change the tissue. And supposedly you can also get like more a lumpier feel. But the cancer's gone, right? So that's the win. But if you're already knowing that it's going to shrink it down, they don't know how much it's going to shrink it down. So that's where the volume, it's like, do you want that? And if, let's say, like, they shrink it and you don't like it, it's asymmetrical. Well, breasts are naturally asymmetrical, if you know anything about that. But if it's noticeably different, the solution is they shrink the other side. So it's just like, I don't know too many people that like that as the other option. So it was just like, these are crazy decisions, but they're the decisions that you have to make. So before they do that, you want to have that figured out, because doing surgery on a side, and a body that has had radiation is totally different. Your body responds differently, your skin's different, the way it's going to tug is going to be different. And I don't still understand, how much does the swelling go down before they're going to start the radiation, so we can get a sense. And then the even hardest part of all this is that it takes about a year, maybe even 2 years, before you're going to really know what it's going to look like and how it's going to settle. So this swelling, I already knew. I was just trying to get past the first initial weeks of swelling to get some idea of like what am I dealing with. But it was still going to take months before I could fully understand. All right, this is my new reality. This is my new look. This is my new body to love and embrace. So that's where I'm at in the breast cancer journey. I get to go see my surgeon. She's gonna, like I said, tell me more about what specific type of breast cancer I have because the tumor pathology should be back fully by now. We're also going to look at the surgical wound to see how it's healing. And we're also going to start talking about my next steps for radiation oncology. And the part I didn't mention, or I kind of touched on, is yes, I get put into menopause, but that's because they're going to force me. I shouldn't say force, but I'm doing hormone replacement therapy to ensure that the cancer is not fed by my estrogen and progesterone so that I can live a long, healthy life with my kids. And the key with breast cancer is early detection. So catching this early has always made me feel like, hey, like, yes, it sucks. Yes, I'm not thrilled about it, but I'm fine. Like, I've never felt this idea that, oh my God, I could die. I've never felt that part. I've just more been, I was a little nervous about surgery the second time because I was just like, man, how is my body going to respond to being back under anesthesia? Like, could something different go wrong? But I've always felt technology's come a long way. People are living a lot longer. Breast cancer research gets a lot of attention. It seems like Susan G. Komen breast cancer. I knew that name before I found out I have breast cancer. It seems like they've got a lot of momentum. So I've always felt I'm gonna be fine from that regards. But the part that is starting to get to me and show up that I knew was a possibility but didn't fully anticipate is just like the emotional ride of it all. And that's why they'll ask you all the time, like, do you need to talk to someone? When I first got my diagnosis, people would ask me, like, how are you? Like, tell me how you really feel. And I'm normally that person, like, let's keep going. It's fine, no big deal. And I know I'm not gonna die of cancer. I know that. I claim that. But what I don't know is, like, when they tell me how often am I getting radiation, how is that going to impact my ability to work? How is that going to impact my energy level with my kids? I do get a little bit more testy. Sometimes I think that's maybe the whole menopause aspect of this. But I also know that it has a lot to do with there's a lot of pieces to this, a lot of decisions, and it's a lot of weight to carry. And I try to stay lighthearted about it. And every book I've read has talked about, your health is connected to your mental state and your wellness journey is impacted by that. So I remind myself all the time, ooh, sorry. Like I just felt a little tingly pain. Um, And after my first surgery, they actually told me about because it was the nerves behind the nipple that I don't know if it's a phantom pain, but that was just gonna happen. But anyway, um, I bear in mind every time that happens that in order for me to heal, in order for me to stay healthy, in order for cancer to never be allowed back in, I have to maintain a spirit of resilience, of strength, and that I can do this. It's as simple as that. Like, I will have to coach my kids through, yes, mommy gets moody and mommy gets grumpy about all the decisions she has to make. But at the same time, um, as long as we all stay focused on my healing and that I'm a survivor already. Me and my girlfriend were talking about the other day, like we already knew this cancer's gone. The surgery was just to make sure that it was for sure gone, but we weren't accepting it, we weren't claiming it, and your body can do a lot of amazing things. So, what was it, a month ago that Ananya Lewis died? Ananda Lewis died of breast cancer. And I just learned a little bit more about how she knew her mother had breast cancer. She chose not to have the lumpectomy. I'm not going that route. Like, I'm still taking my breast cancer smoothie, not as consistently as I was because I switched to just leaning into the soursop. But I really heed the advice of early detection was key, not waiting. A lot of times when I meet with my surgeon, my surgeon, my oncologist, my radiologist, the whole cancer team, their key was, and when I did my second opinion over at UIC, even they were saying, I just want you to make a decision and get the cancer treated more so than I want you to pick me. And I really appreciated that because some people who get this diagnosis wallow in it and they delay the decision and it ends up making things worse. When I went to get this is the last story I'll share. When I went to get one of my post biopsy, after every biopsy, you get a mammogram and they call it a soft mammogram. So one of the mammogram techs was telling me about a woman who was pregnant when she noticed that she had a lump in her breast and it was really hard. And her OBGYN had decided, let's get through the pregnancy before we deal with this tumor. Well, she had an aggressive type of cancer. And by the time the pregnancy finished, I think she only lived like a couple months after the baby was born because they didn't do anything about the tumor when it was first discovered during the pregnancy. And another girlfriend of mine found out about hers, like, was talking to her OBGYN while she was giving birth about what is this, and she delivered and then had to go into immediate cancer treatment. So what I'll say to you all is, don't delay treatment. Early detection is key, but also, you know, if you're in my peer circle, it's unfortunately becoming more commonly found in women in my age group. And if you can't tell, I'm over 40. Uh, it in the genealogists, because you do get genetic testing, and I got that out the way, and it wasn't in my genes. She said there's a lot of they're finding in my particular age group that there's got to be some environmental factor that is leading to more breast cancer in our age group, and they don't know what it is just yet. But the great thing is that the technology has come a long way. They're detecting it earlier, so that's why the survival rate should also increase. So that's where I'm at. I'm going to the doctor soon. I need to go ahead and finish getting back ready for that. But I did want to share it because I thought maybe the bruising would be gone all the way by now. And it's the swelling's down, but the bruising's still there. So I'll find out from the doctor how much longer it will look like that. And like, I exercised for 10-15 minutes. I did a low impact exercise yesterday morning, and I've just, y'all, since I found out, I will say I gained too much weight to the point that my BMI puts me in the overweight category, which I don't think I've ever been in before. No, I haven't, because this is the highest weight I've ever been. Um, but after that exercising, like, I could feel my body just wasn't, like, I can't move this arm the same way. So I'm not sure if I overdid it. But I know my surgeon was saying we all have to move as well. So they do and they don't want me to exercise. I definitely need to stay active post surgery. They just needed me to take it easier. So send all the good vibes. If you pray, send up a prayer that, radiation is going to still allow me to work sufficiently, because the reality is, I can't afford to not be working too much. And there's actually a lot of breast cancer resources. There's even, like, we've even put out a thing for one of my girlfriends. I think she nominated me for um, for a vacation. So I'm gonna take all the silver linings and run with it. But yeah, I really do need to get ready. So y'all have a great day. Mwah. Bye.